Hi there, my name's Dr. Tony Dicker and I teach the Professional Certificate of Skin Cancer Surgery. Welcome. I want to tell you something about what we teach during this program. This is designed to be an introduction to skin cancer surgery. This is not just about teaching you flaps and grafts, but also teaching you some of the foundations of basic skin cancer surgery and ellipses, the common part of skin cancer surgery in primary care. So our focus is very much on what should be done in a general practice setting. We start the program with the basics. We make sure you're tying knots correctly. We make sure your technique for how you hold your needle holders is correct. Just some very simple basic tips, and we go through the process of trying to do a perfect ellipse. So we are assuming that you're already doing ellipses, but we think that everyone can do them better. And so our start for the course is, let's try to perfect your technique of doing ellipses. Once we're comfortable that everyone's in the right place and able to do the basics, we then move on to grafting. And again, we're not trying to teach you exactly where to do a graft in which situation. It's the principles and the technique of doing a graft, which you get to apply in the circumstances that meets your patient's needs. So we understand how a full thickness graft works and go through the practice of doing that. And we understand how a split skin graft works and where you might apply that. These sessions are all performed on pork belly, and we get an opportunity to actually do this in a practical sense rather than just theory. We then move on to the principles of flaps, and there's three basic types of flaps. There's transposition flaps, there's rotation flaps, and there's advancement flaps. And there's one session on each type. Again, we're not trying to teach you exactly where to use a particular flap. We're getting you to understand why these things work. So we start with rotational flaps, the type of flap I might be using on the scalp. And we understand the mathematics of why these work. We understand where you have to do dog ear repairs. And again, we use a pork belly and practice the actual technique. So you've actually been through the process of removing the tumour, performing the flap, closing the defect, and get that solid understanding of how the whole process works. We then move into rhomboid flaps or transposition flaps. And again, there's a couple of different types of rhomboidal techniques that we understand, and we practice those on pork bellies. Our final session with pork bellies is on advancement flaps, and there's a number of different flaps which are understood and named. We don't try to teach you every single possible flap that exists. We are very much looking at understanding the principles and basics of how flaps work, so that as you see a patient with certain circumstances, you can then apply those principles to close up their defects. We're not just focused on teaching you how to do skin cancer surgery. We want to look deeper than that. We need to understand also how to manage other problems. So we do look at managing complications. And that's very important. I've always described it that a good skin cancer doctor can do the procedures. A great skin cancer doctor can manage the problems. So we do look at how to manage wound infections, how do we manage bleeding of wounds, how do we manage keloid scarring. Other types of complications is a very relevant and important part of your patient management. We don't like the idea of complications occurring, but reality is they do, and it's important we know how to manage them. Our final session for the Professional Certificate of Skin Cancer Surgery is discussing the technique of Mohs surgery, and we're not trying to teach you how to become a Mohs surgeon. We're explaining what it is and when you would refer someone for Mohs surgery. We also then look at cases, and we then put your new knowledge into practical application. So we have examples, and we let you look at how you might close a defect, what the options are, and discuss what can work and why. So overall, we're trying to give a very good introduction to skin cancer surgery, not just ellipses, but also with flaps and grafts, and keeping it all very practical in application for what you can do in your own primary care setting.